Hey everyone, and welcome. Today we are going to break down one of the most fundamental clinical skills you absolutely have to master, both for your exams and for your practice: initiating peripheral IV access. So let's get right into it. My goal here is to give you a super clear, step-by-step guide that's really going to build your confidence. We want you to nail that perfect technique every single time. So whether this is for a skills checkoff or for the NG-NCLEX, don't worry, we've got you covered. We're going to walk through 5 main phases. First, preparation and site selection. Then, the insertion itself, what I call the perfect stick. After that, confirming and advancing the catheter. Then, securing, flushing, and finishing up. And finally, the all-important documentation and exam essentials. All right, let's kick things off with phase 1, preparation and site selection. I'm telling you, getting this part right prevents most of the common mistakes and just makes the whole process so much smoother for both you and your patient. Okay, first things first, we've got to talk safety and communication. You walk in, you introduce yourself, you make sure you have privacy, and you always verify your patient with 2 identifiers. Then, you explain what you're about to do. This builds trust. And of course, hand hygiene and gloves, that's an absolute must. Look, this isn't just some checklist. This is how you build a foundation of trust and prevent infection from the get-go. So now it's time to find that perfect vein. After you get the tourniquet on, you're going to use your index finger to palpate. You're not just looking, you're feeling. You want a vein that's soft, kind of bouncy and elastic, and relatively straight. Think of it like a tiny submerged trampoline. A vein like that is going to support the catheter really well and is way less likely to cause problems down the road.
Okay, time for our first NGN checkpoint. Picture this. You've found the perfect vein, the tourniquet is on. What is your correct action before you even think about cleaning the site? You've got to release that tourniquet. Why? Well, your cleaning procedure is going to take at least 30 seconds, and you don't want to leave that tourniquet on that long. Releasing it allows for normal blood flow, and it keeps venous pressure from building up while you get your supplies ready.
And now for section 2, where all the action happens. Insertion. Let me tell you, your precision and your technique right here are absolutely critical for success. So before you stick, you have to clean. And I mean really clean. You're going to take a chlorhexidine swab and scrub the site with a back-and-forth friction for a full 30 seconds. Then, and this is so important, you let it air dry completely. Don't fan it, don't blow on it, that just introduces germs. The solution needs that time to do its job and kill the bacteria. This step right here is your #1 defense against causing a nasty bloodstream infection.
All right, you've reapplied the tourniquet, you're anchoring the vein with your non-dominant hand. It's time to go in. Your angle of approach should be somewhere between 10 and 30 degrees. This specific range is key. Think about it. If you go in too steep, you're going to go right through both walls of the vein. But if you're too shallow, you might just slide right over the top.
Now this slide shows a detail you just have to remember. Always, always insert with the bevel up. The bevel is that slanted tip of the needle. When the opening is facing up, the sharpest point pierces the skin first. This makes for a much smoother, less painful entry, and it creates a clean opening instead of tearing the vein.
So you've pierced the skin, now we're in phase 3, confirming and advancing. This is a moment that requires a really steady hand and some calm, deliberate moves.
The moment of truth is what we call the flashback. This is that little bit of blood that you see return in the catheter's chamber. It's the visual signal that tells you, yes, success, the tip of the needle is inside the vein. The second you see that flashback, you have to act. First, drop the angle of the catheter until it's almost flat against the skin. Then, advance the entire thing just a little bit more, about 1/4 inch, to make sure the plastic catheter itself is in the vein, not just the needle tip. And finally, you're going to retract the needle just a bit while you push the plastic catheter the rest of the way in. This whole sequence is designed to stop you from accidentally poking through the back wall of the vein. Okay, NGN checkpoint #2 for you. The catheter is all the way in. Before you pull that needle all the way out, what is your very next immediate action to stop a hematoma from forming? The answer is you need to apply pressure with the middle finger of your non-dominant hand about 1.25 inches above the insertion site. This blocks the vein. It stops blood from spilling out and forming a big bruise when you finally remove that needle.
We are on the home stretch now. Section 4 is all about securing, flushing, and finishing. This is where we make sure the line is stable, it's safe, and it's ready to be used.
Now, here is a rule you have got to remember. After you take the needle out and activate its safety device, you must release the tourniquet before you flush the line. If you try to flush against a tight tourniquet, all you're going to do is force fluid into the tissue around it, which causes a painful infiltration and basically blows the vein.
So, while you're still holding that pressure, you're going to connect your primed extension tubing. Then, you gently flush with normal saline, and as you're doing this, you're assessing for patency. You should feel zero resistance. You shouldn't see any swelling or bubbling at the site, and the patient shouldn't feel any new pain. This is how you confirm your IV is in the right spot and it's working perfectly. Once that IV is secured with a nice transparent dressing, it's time to label it. This is a huge focus on exams, so don't forget this part. You have to include the date and time you put it in, the gauge and length of the catheter you used, and, of course, your own initials.
And for our final NGN checkpoint, the dressing is on, it's secure, but what key part of the setup must it never ever cover? The answer is the connection point, where the extension tubing actually meets the catheter hub. That connection has to be visible at all times so you can easily check for any leaks or if it accidentally gets disconnected.
And finally, let's lock it all in with Section 5, Documentation and Exam Essentials. You know the golden rule of nursing, right? If you didn't chart it, it didn't happen.
Your documentation has to be precise. You're going to record the date and time, the catheter details like gauge and length, the exact location where you put it in, how you confirmed it was patent, and your initials. This creates a clear legal record of what you did, and it's absolutely vital for continuity of care.
So the ultimate takeaway, the memory anchor I want you to walk away with, is this simple sequence: ID, vein, clean, stick, flash, advance, secure, flush, document. Just burn that sequence into your brain. It is your roadmap to a perfect IV start every single time.
You know, mastering the technical steps is really only half the battle. The other half is the true art of nursing, keeping your patient calm, feeling safe, and informed. So I'll leave you with this question to think about. Now that you've got the procedure down, how are you going to master the skill of patient reassurance?